begin. Thank you so much for joining us today. My name is Lori Marie Peixoto, and I'm the Outreach and Education Coordinator at NeedyMeds. We're a national nonprofit organization. We're an informational resource, and we aim to connect patients, their healthcare providers, their advocates, with programs that provide financial assistance for their healthcare costs. Just a few housekeeping points before we get started with our special webinar today. The audience will remain on mute for the duration of this presentation. Should you have any questions for our guest presenter, please go ahead and type them into the chat box, and Clorinda will answer them at the end of her presentation. Also, I want to let you know that this webinar is being recorded, and it will appear on the NeedyMeds webinar library page towards the end of next week or possibly in the beginning of the following week. So if you've missed part of this webinar or you want someone else to see it who wasn't able to make it today, you can find it on our webinar library page. And should you have any questions about this presentation or would like a copy of the slides, I will provide my contact information at the end. So let's begin. So I'm very pleased today because we have a special guest presentation. Today, Clarinda Wally from Good Days from CDF will be our special presenter. She'll be discussing navigating financial assistance. Clarinda Wally leads the charity with more than 18 years of experience in the healthcare industry, and she also has over 6 years of experience in strategic philanthropy. Reporting to the Board of Directors, Wally oversees the strategic and operational responsibility for Good Days staff, programs, expansion, and the execution of its mission. And with that, let's give her a very warm welcome. And I'm turning the presentation over to Clorinda right now.
So let us begin.
Across the country, people are in a fight for their health, hoping for a good day. But because of massive copays, over a third of insured chronic disease patients struggle just to buy their medication. So battling their disease is impossible. When you donate to Good Days, you give vital medication to patients struggling with chronic illness, helping them fight their disease. And the day they can fight is a good day. Join us.
Good afternoon. I'm Clarinda Wally, as Lori indicated, the Executive Director of Good Days from CDF. Thank you all for joining me in this webinar presentation. And I'd like to extend a warm thank you to NeedyMeds for their great work and for allowing myself and Good Days to contribute to that mission here on this platform. As a chronic disease sufferer myself, I understand the difficulties of managing chronic illness while worrying about important financial obligations. I have ulcerative colitis, diagnosed with that chronic condition at the age of 35 years old. It was a long struggle for me to first identify what exactly was going on with me, and then to find the most appropriate care and treatment for my disease. Eventually, the progression of my disease led me to having a colectomy, an ileostomy, and then fortunately, a reversal of that I am 41 years old today and healthier than I've ever been and truly appreciative for the medical care and support that I received, but certainly navigating through it. And I consider myself, having been in this industry for so many years, to be educated in the navigation of it. And I found it very difficult and trying when you're dealing with medical issues, depression, work, family. There are so many things involved, and it was just a blessing to have a support system around me, both through a provider network and a family network, that enabled me to become healthy again. And I started working at Good Days from CDF in 2007 with a true understanding of what it's like to be a patient who suffers from a chronic disease. and hoping to be able to give back and provide something to the community that I think that somebody who's never been through it cannot do. So again, I thank you for having the opportunity to speak on behalf of patients who suffer from a chronic condition. When dealing with the disease or illness, covering medical expenses is not easy, and it's important that people understand and seek out the many different financial assistance options available. I'm going to use my time with you all today to explain the different avenues of assistance available and to provide you with information on navigating through the process of finding assistance that matches your needs. Knowledge is a powerful thing, and once you know what options you have and are better informed, you'll become empowered to handle the challenges that come with this undertaking. Before we begin, let me tell you a little bit about Good Days from CDF. Good Days is a nonprofit organization that provides copayment assistance for much needed medication to people suffering from chronic disease who can't afford their necessary treatments. We were founded in 2003 by a gentleman who suffered from a chronic disease, Crohn's disease, and understood the expensive medications that are needed to treat this type of therapies, and found that there wasn't a lot of financial avenues available to help those patients who needed a treatment but couldn't afford it. We've served nearly 500,000 patients and are the largest provider of copayment assistance to date. In addition to providing copay assistance, we help with premium assistance as well as travel assistance, which we'll get into a little bit later in this presentation. Our goal is to help everyone that calls. We may not be able to provide financial assistance, but we will always do everything we can to help find other resources that can help. Cost restrictions pose difficulties when patients are seeking care. Despite insurance coverage, many medications for life-altering conditions still pose exorbitant costs to patients. At Good Days from CDF, we don't think that anyone should choose between quality of life and vital medications that they need. In addition to battling a serious and potential debilitating illness, many patients and their families have to navigate the confusing and costly web of insurance, co-payments, and necessary travel. Chronic illness is not just a crisis in the United States, it's become an epidemic. Chronic disease accounts for nearly 75% of the overall healthcare costs. In fact, 3 out of every $4 spent in healthcare is due to chronic illness. Chronic disease affects nearly 50% of our country's population. That's 1 in 2. 7 out of 10 people will die from a chronic disease. And despite the high incidence of these types of illnesses, many of these chronic conditions are preventable or controllable through modified behavior. For the multiple diseases that are not preventable, those that are genetic in nature, patients need help knowing how to access care and must understand what they can do to support their condition. Improving quality of life starts with getting your condition under control and by finding and establishing ways for accessing medication and care. Because we so believe that with more knowledge and awareness that this situation can get better, Good Days has been working on Capitol Hill to establish a National Chronic Disease Awareness Day. We would like to establish just one day a year where people from all across the nation can come together to share, educate, partner, counsel, and increase the level of awareness and the real need this country has for more support. You're looking at our CD Awareness website page, where we ask supporters to sign a petition, which we took to Congress as support for this request. We were in Washington again just last week, and we were encouraged with the feedback we received. We hope to be able to announce something official soon. I'd like to take a minute and show you a brief video that we did share with Congress and share some of our staggering facts about chronic disease in our country.
What difference can a day make? The sun rises and the sun sets. What has changed? Today, 4,700 people will die because they have a chronic disease. Every day, 7 out of 10 deaths are due to chronic disease. Here in the U.S., 3 out of every 10 people will spend this day taking care of the chronically ill. The daily toll is alarming and costly. 3 out of $4 spent every day on healthcare are due to chronic conditions. Every day, treating chronic disease costs the American taxpayer more than $750 million. And yet chronic diseases are the most preventable and controllable of all serious health problems. What difference can a day make? For a patient with a chronic disease, their treatment can make all the difference in the world. It can mean the difference between a good day and a bad one. People that suffer from chronic disease live for the good days, the days when medication and treatments help them feel like themselves again. But there's one day in particular that we want your help with. It's July 10th, National Chronic Disease Awareness Day. That's what it's called, but it takes you to make it official. Join thousands of health professionals, educators, caregivers, and sufferers of chronic disease who agree that simply by increasing national awareness, we can dramatically reduce the number of deaths, as well as relieve the burdens caused by chronic disease. What difference does a day make? It depends on what you make of it. Help us make July 10th into National Chronic Disease Awareness Day, and you will make a day that saves lives. And that's definitely a good day.
Like Good Days from CDF, NeedyMeds is a 501c3 nonprofit that exists to help those suffering from illnesses locate programs that help them afford their medications. NeedyMeds, for instance, helps patients seeking assistance for chronic illness locate Good Days from CDF so that we can assist patients with expenses related to their condition. When someone is overwhelmed with the problems associated with a chronic illness, assistance from NeedyMeds is extremely helpful as patients can become overwhelmed with medical expenses. Access to care is an issue that is very important to myself and other chronic disease sufferers, and is a problem that NeedyMeds and Good Days works to alleviate. We strive to help people with chronic disease have as many good days as possible, and are glad to have a valuable partner in NeedyMeds as we work to achieve that goal. This little cartoon here shows a doctor speaking to a patient in the hospital, and he says, "I'll have someone come in and prep you for the bill." Wouldn't that be nice if we were actually prepped for the bill? But most of the time in chronic situations, we're completely unprepared and unprepped for the financial issues we're faced with, which can surely be frightening. But there is help available, so let's talk about how we can get that help. There are two main categories of insurance situations that dictate the types of assistance you may be eligible to receive. Those categories are defined by uninsured or underinsured. And for each category, even those that are insured with adequate coverage, there are options available to help you cover your medical expenses. It's important to understand the differences and where to go for each, which we will cover today. We will also cover today some common insurance issues people can run into, important questions that you should ask when reaching out for financial assistance options, and some of the additional benefits that exist but you might not be aware of or think to ask for. Let's start by focusing on uninsured patients. With the implementation of the Affordable Care Act, the prevalence of uninsured rates has decreased, but there are still plenty of people who still have no insurance at all. For uninsured patients, there are free drug programs that are available to treat diseases and illnesses. To access these free drug programs, you must go directly to the pharmaceutical manufacturers of the treatment you're looking for. It's important to note that if you're eligible for Medicare or Medicaid, you may apply for a free drug program, but that program would likely only last through the calendar year, at which point you would ask to seek the appropriate insurance option that is available to you. Many of the manufacturer programs that are available for free drug also have support systems behind them. So when trying to access this information, if you're uninsured and you're looking for assistance for a specific medication, you could go to the NeedyMeds website and input the product name, and it will direct you to the manufacturer of that product. And typically, they will have programs in which you can apply for that offer free drug and can get you through a calendar year until the point in which you can apply and receive adequate insurance coverage. Additionally, there are often financial requirements, such as you make less than $100,000 a year to be eligible for free drug programs. Each manufacturer has different eligibility requirements, but in all that we've seen, generally you must make under $100,000, and each program is different. Some are under $75,000 and others under $50,000. But contacting the manufacturer program directly will provide you the guidance that you need and the information that you will need to move forward if they'll be able to assist you. And again, all you need is the name of the product that you're seeking, and NeedyMeds can direct you to how to apply for uninsured coverage through the appropriate manufacturer. Next, let's cover financial assistance options for underinsured patients. Underinsured is defined as any individual who cannot afford their out-of-pocket costs for treatment after their insurance has paid its portion. And so, there is not a dollar limit set for what is uninsured. We have patients who have to pay $50 for their medication and they cannot afford it. They would be considered underinsured. We have patients who have a $2,000 payment after insurance. They as well would be considered underinsured. So again, underinsured is defined as if you cannot afford the medication or your treatment after the insurance has paid their portion. Underinsured patients include individuals that have government-sponsored insurance, such as Medicare or Medicaid, or even commercial insurance, but are seeking assistance to cover their medical expenses. There are two different types of programs available for underinsured patients. The first one I'm going to talk about are the programs that are available to patients who have government-sponsored insurance. And when I say government or federally sponsored, I'm talking about patients who have Medicare or filling their medications through a Medicare Part D program. The charity programs will be able to help them. There's something to note. Good Days from CDF is a charitable program. There are other organizations such as Cancer Care, Patient Access Network Foundation, and HealthWell that provide assistance to this patient population. Federally insured patients must go through a 501c3 charity like the ones I mentioned to receive financial assistance. And typically, the financial criteria is a patient cannot exceed 400% of the federal poverty level. We also require that you fill out an application that captures your medical insurance and financial information, which will need to be verified with documented evidence. These applications can typically be filled out online via a printable form, or you can call a charity directly for verbal confirmation of your status. And in turn, they'll send you a pre-filled application that would then need your validation and signature along with proof of income. It's important that patients that have medical insurance and proof of income information It is important that patients have that medical insurance and proof of income information available so that the charities can assess how they can help you. Typically, when you're calling them, there's a series of questions that we're going to ask you, and so it's important that you have that information available. Underinsured patients must go, again, through a 501c3 charity to seek financial assistance. And I want to reiterate again, when you're seeking assistance through a charitable program, if you have Medicare or Medicaid, this is the only available avenue of assistance for you. If you are commercially insured, charities like Good Days will also have the ability to help you. And so I qualify that because the next level of assistance that I'm going to talk about is strictly available for only commercially insured patients. So whereas commercially insured patients can go through a charity or go directly with the manufacturer, federally insured or government insured patients can only seek assistance through a 501c3 charity. For patients with commercial insurance that are not sponsored by government programs, there's a variety of assistance options available. For example, if you suffer from multiple sclerosis, there are many of the manufacturers who provide medications or produce products that support multiple sclerosis that have what are called marketing programs. You can seek them directly, and they have programs that will pay your out-of-pocket costs after insurance. Depending upon the manufacturer and the product, they'll have monthly caps or will cover your total copay outside of insurance. And generally, again, you can go through NeedyMeds, which will direct you to those manufacturers, and they can get you set up on their programs. Typically, there's no financial criteria, and you would need just to provide them some basic information, such as your name and date of birth. All of these assistance programs can be applied to online and are accessible via the relevant manufacturer's websites. Product assistance programs for insured patients provide a copay offset. Sometimes they're called coupon cards. So for example, if through your insurance you're required to pay 20% of your medication with your insurance picking up the rest, the pharmaceutical manufacturers will provide additional assistance directly to your pharmacy to help cover that 20%. Copay assistance, such as the ones I just described, also can be found on the NeedyMeds website. Some common issues that you may run into when seeking assistance I'm going to cover. So it's important to remember that organizations like Good Days from CDF will need sensitive information such as your social security number, date of birth, diagnosis, treatment, and name of your physician. These details will help us assess your coverage needs. Everything provided is confidential, and that information is strictly utilized to help the patient gain financial assistance. It is also important to remember that charities like Good Days help commercially insured patients as well as patients covered by government-sponsored insurance. Manufacturers that offer free drug programs, on the other hand, only provide assistance for those with commercial insurance or none at all. Manufacturers and free drug programs are not allowed to help people with government-sponsored insurance, such as Medicaid or Medicare. Also of note, sometimes a patient has to take a diagnostic test to figure out what the best treatment is, and in many cases, those diagnostics are not approved by an insurance plan like the product is. For instance, a drug may be approved by the FDA and come to market before the diagnostic test is approved, and therefore the diagnostic test is not covered. In those instances, charities like Good Days will cover the costs related to the diagnostic testing for certain disease categories. There are assistance options available beyond just providing financial support that are critical resources in achieving health and wellness. Treating disease and illness goes beyond covering medical expenses and can also require travel expenses, psychosocial support, and other means of care, including premium assistance. And there are certain states, Good Days from CDF has been providing premium assistance for several years. We have come across this year patients in which we're providing premium assistance that their insurance plan won't allow us to pay for the premium directly, and the patients are having to come out of pocket. So if any of you have come up into this situation, please know that we're doing everything in our power and going again to talk to our government to see what we can do to continue to help those patients who are struggling to cover their premiums and their out-of-pocket costs, and working with the insurance plans to ensure that we get you adequate coverage without the patient having to come up with money out of pocket that they do not have. Many organizations, including Cancer Care and the Health Wall Foundation, also provide support for these additional expenses, including travel support and counseling services that are valuable resources to the patient. For example, the cancer support community provides trained counselors that act as case managers on behalf of the patient and help navigate through the process of receiving all of the benefits available to you. Groups like Cancer Care will not only help with assistance programs, but will connect the patient with therapy treatments and support groups to provide a holistic approach to wellness. If it's outside of medication, I recommend calling the manufacturer's help desk, and they can provide specific direction on the advocacy groups that they have special relationships with. More than likely, the manufacturers work with several of the organizations that support these disease categories and can direct you to the most appropriate organization that can help with your needs. Also, calling organizations like Good Days from CDF, Health Wall, and Cancer Care. If we cannot provide the assistance you're looking for, if we do not have it, we will direct you to the most appropriate organization, such as patients calling Good Days from CDF. We strictly today help with financial assistance. So when we have patients that we're treating that have a form of cancer and need assistance outside of copayment assistance, we will direct them to Cancer Support Community or Cancer Care, who have 24/7 availability of counselors that can provide psychosocial support and education to those patients. When seeking out options for assistance, there are questions that you want to ask. What are the different options of support beyond copay assistance? Do you cover support for specific treatment needs? Are there other types of assistance that can help me better care for my disease? Do you cover diagnostic testing? Is there travel assistance available? The organization you're speaking to should be able to point you in the right direction. And different organizations offer different programs. If you purchase insurance through an exchange and still need supplemental insurance, where do you go? Even patients receiving a subsidy under those insurance programs are still considered commercially insured and could benefit from reaching out to a manufacturer's commercial program. Also, an important difference between a commercial program and a charitable is that the manufacturer only covers their own medications and therapies, whereas the charities cover all medications and therapies that are indicated for a disease category. So, for example, when you come to Good Days and are seeking assistance for multiple sclerosis, Good Days from CDF will cover all products that are FDA indicated to treat multiple sclerosis. Going from a commercial perspective, if you're on a specific medication, you go to that specific manufacturer, and any support that they provide will be specific to their medication, to the product that they produce. So again, that's just another thing to consider. Again, charitable organizations exist to help patients who have federally sponsored insurance get medication coverage that they otherwise wouldn't have access to. There is help out there, and there are a number of organizations that will do everything in their power to help guide you. NeedyMeds is an excellent resource for a robust platform for finding information by product name or by different types of assistance. There are various types of care and services available to disease sufferers, so you must feel free to ask. There are a host of issues that come with treating chronic illness, so please keep that in mind. Never be afraid to ask a question, and always feel free to reach out to Good Days from CDF if you have any questions or if you have trouble finding the assistance you're looking for. Most importantly, never give up hope. Thank you all again for your time today.
Well, thank you so much, Clorinda. Do we have any questions in the audience right now? If so, please type them into your chat box. I'll give you another moment. Okay, if there are no other questions at this time, any questions for Clorinda at this time? I'll give you one more moment.
So if I can be the first to go with the question, a question that we receive often is when a patient is seeking assistance, let's say for prostate cancer. Well, we also offer travel assistance for prostate cancer patients. And one of the questions we receive is, do you have to apply separately? And the answer to that question is no. Once you qualify in a calendar year to any assistance Good Days from CDF offers, then any other program that we have, that same application and approval will apply to those programs. And another question we often get asked is, when applying for assistance through Good Days, and if there is no assistance available, can we take that application and use for the other organizations that are like Good Days? And the answer to that is unfortunately no. Each of us are a little bit different and require a little bit different information. So the enrollment form you fill out for Good Days would not be the same form that you would fill out, for example, for Cancer Care or Patient Access Network Foundation. Certainly, in general, we all require the same information, such as name, demographic information, date of birth, Social Security number, insurance information, and financial information. The various organizations where we kind of differ is the financial income that we take. So, for example, a W-2 would be sufficient at Good Days, but another organization may not only want your W-2, but all income that is coming in through the house, and some may do asset-based testing where Good Days does not. So it's important to, if you apply at an organization and either do not qualify or they no longer have assistance for that category, to keep all that information on hand, as it will come in handy when applying to the next organization.
Okay, I'm just reading through some questions here. One question is, how has the Affordable Health Care Act had an impact on copayment assistance programs?
That's a very good question. And I can tell you that from a Good Days perspective, we have not seen a huge upturn in the number of patients needing assistance. And I would believe that that's due to the fact that any patient going through the exchange is going to be considered commercially insured, and more than likely be referred to a manufacturer program versus the charitable or 501c3 organizations.
Okay. Another question was actually probably more directed to me. How can you have a copy of these webinar slides? In a moment, I will provide you with my email address, and you can email me, and I will email you back a PDF of Clorinda's slides. So I'll do that in just a moment. This question is from Barb. The question is, do you have a one-page summary that details what steps to take for each type of assistance?
Well, I can certainly provide an overview via slide that I can provide to you, Lori, and then you can provide to whoever's seeking it. And it can give you a general overview of what 501c3 charities do versus commercial programs.
Mm-hmm. And another question, this one's from Donna. Do you serve Alaskans?
Absolutely. So in general, what you're going to find across the 501c3 organizations is we all provide assistance to U.S. citizens and others. And so at Good Days from CDF, we require a social security number, and that's how we validate if you're a U.S. citizen. Some of the other organizations do U.S. citizens as well as U.S. residents, but certainly Alaska, Puerto Rico, Guam would be covered through Good Days.
Okay. And Tisha's writing in to ask, I only work with Medicare members, so I need to refer them to a 501c3 charity for assistance. Is this correct?
That is correct. So if your patients are needing assistance for their medication treatments, manufacturer commercial programs cannot help those patients. They must go through a 501c3 charity. You know, and again, there are many of us out there, and while some of the categories in which we serve overlap, there are other conditions in which specific organizations can provide assistance to. So I highly recommend utilizing the NeedyMeds website, as well as going through the specific charity websites. As on all of our web pages, we provide you with a list of the disease categories in which we provide assistance to, as well as the medications.
And I'll also mention that the NeedyMeds website includes assistance programs from Good Days. So you should be able to pull up those programs on our website as well. And again, if you had any questions specific to eligibility requirements or the application for those programs from Good Days, you can feel free to contact Good Days for more information.
Absolutely.
Let's see. And this is an interesting question here from Emily. If I receive help from a charitable organization, must I report it on my taxes?
So that is certainly a question that we get a lot, and unfortunately, I'm not able to provide any direction in relation to an individual's taxes. I would certainly want to point you to an accountant or someone that is trained in that, because I can't provide that type of guidance.
And a question from Kim is, do travel expenses typically include motel, hotel stays?
At Good Days from CDF, the way that our program works is patients who are needing travel assistance, each category, depending upon what the patient's diagnosis is, has a different type of limit. So for example, when we are providing travel assistance for patients with prostate cancer, the max available funding is $1,500. And so in a calendar year, we have that amount of money per individual available to provide assistance. And so with that, we would work as a travel concierge on behalf of the patient. If airfare was needed, we would not only book that, we would also book the accommodating hotel stay and ensure that there was a ride to and from the doctor's office. For other programs that we provide assistance to, there's a $300 a year cap. And so it's not going to get you very far if you're having to utilize air transportation or needing to stay in a hotel, but it will certainly provide coverage for gas expenses, parking expenses to get you to and from the doctor's office.
It's fantastic that those programs are out there. That's wonderful. Here's a question. Are long-term antibiotics for Lyme disease covered in your programs?
Unfortunately, at Good Days, it is not. So our product formularies are based on FDA indications specifically. Ancillary treatments in support of the condition we currently don't have support for. But I certainly, in those cases, I certainly recommend going through NeedyMeds because any available assistance for that medication will be found.
Yes, and NeedyMeds website also has other sorts of assistance as well beyond just prescription medications on our website. And you'll find those under the Patient Savings tab. And then if you click on Diagnosis-Based Assistance Programs, you can search by the name of the diagnosis and pull up everything relevant to Lyme disease. Here's a question from Christina. I'm calling from a provider's office. If I submit a patient's EOB to Good Days, will they pay only the drug cost, or will they also help pay administration, labs, office visits, etc.?
Good Days specifically will only cover the product. I know that there are organizations out there such as Cancer Care, if the patient is suffering from a cancer, that will cover administration costs of the chemo or the infusion. However, Good Days from CDF only covers the medication costs after insurance.
A question about do charities such as Good Days also provide things like nursing care?
Again, Good Days does not, but however, there are organizations that do.
Mm-hmm.
It is my hope that one day Good Days can expand the amount of coverage we provide for patients. Unfortunately, today we do not, but I know that there are other organizations, 501c3s, that do cover those types of expenses.
A question about how long typically does the application process take at Good Days?
That's a very good question. Any patient who calls Good Days today, if we have assistance available, we'll get coverage immediately. We will take a verbal confirmation of the patient's demographic. We'll collect all the information over the phone. So I would say typically it's about 15 minutes. So as long as it takes to get through a call, so long as the patient has all of the information that we need. What will take place next is we will have a pre-filled application filled out based off of the information collected over the telephone. It'll get mailed to the patient, and we would need the patient to have that back to us within 21 days in order for assistance to continue. So what we call that is conditionally approved. So based off of a verbal confirmation from the patient, we would conditionally approve the patient for the first treatment. After that point, we would work with the patient to get the paperwork back, which is it's a 3-page document. It's a HIPAA authorization, which the patient would need to sign in order for us to continue to work with the provider or the pharmacy that we are paying the cost of the treatment on behalf of the patient, as well as a pre-filled form that will include the information that we collected from the patient. So it's 2 signatures and then proof of financial income.
That's incredible. I have a couple of questions about the contact information for you, Clorinda, as well as your website address. Do you want to put up your last slide again?
Absolutely.
There we go. Okay, I'm just reading through the last couple of questions here. We have a lot of thank yous coming in for you, Clorinda, and also for Good Days. Lots of appreciation and gratitude out there for all the work that you do. What is the website address?
It's gooddaysfromcdf.org.
Okay.
Sorry about that. I should have included it on this slide.
Oh, no problem. No problem. Well, I think that's all the time we have for questions today. If we didn't get to your question, we'll try to send you a personal email response. I'm going to give you my contact information right now. Give me one moment to do that. Okay. So this is my contact information. If you have any questions pertaining to this webinar or you'd like a copy of the slides, please send an email to Lori@needymeds.org. If you have any questions related to drug discount cards, partnering with NeedyMeds, having a webinar for your organization, something like that, feel free to give me an email. If, however, you are seeking financial assistance or you'd like some assistance navigating the NeedyMeds website, please use our helpline at this toll-free number written in red. And I want to give a very warm, special thank you to Clorinda for giving us her time today, for sharing her story with us, for all of her efforts to advocate for those who live with chronic diseases, and for everything that Good Days has done to help patients. NeedyMeds is really proud to partner with Good Days, and we are always so grateful when we can refer patients to you. We really admire the work of Good Days, and we're so grateful for your time today, Clorinda, so thank you so much.
Absolutely. Thank you again for the opportunity to speak with you all. And again, I just want to let everyone on the call know, please feel free to call us or email us directly if you have any questions regarding Good Days. We're very grateful to have been provided the opportunity to help this many patients. And, you know, we continue to push forward and hope to expand and be able to provide more offerings to patients who have need. So thank you all again, and we appreciate your support.
Thank you. Thank you, everyone, for attending this webinar, and we'll see you next week for our monthly webinar, which will take place on July 30th. Thank you so much. Have a great day.